Hey guys, we're going to continue on with chapter 9. This lecture is going to be part B. So that's part B. Got one more after this. Alright, let's get started talking about some barrier devices. Alright, take all steps to ensure protection from infectious disease. You can use a pocket face mask, a chimney with a one-way valve and HEPA filter. Some are also equipped with an oxygen adapter so you can add supplemental oxygen when you're delivering breath. Face shield, that's going to be a durable plastic sheet with a built-in filter. This is what a typical pocket mask looks like. You can see the one-way valve on top of it. Right, mouth to mask ventilation. Right, steps for a single rescue or use are to confirm unresponsiveness, open the patient's airway, firmly hold the mask in place while keeping the airway open, breathe slowly into the one-way valve. If the patient does not begin breathing adequately, begin CPR immediately. This image shows somebody providing ventilations with a pocket mask. This is just a side view of the same image. Alright, mouth to shield ventilation. Confirm unresponsiveness and open the airway. Place barrier over mouth. Keep airway open as you pinch the nose. Open your mouth wide. Take a normal breath and place your mouth over the face shield opening. Make a tight seal by pressing lips against the shield. Exhale slowly into the patient's mouth until you see chest rise. Break contact with face shield to allow patient to exhale. Repeat the process for a second breath. If patient does not begin breathing adequately on their own, start CPR. Alright, some common problems with mouth to shield ventilation include failure to form a tight seal, failure to pinch nose closed fully, failure to tilt the head back to open the airway, failure to open the patient's mouth wide enough to receive ventilations, failure to deliver enough air, providing breaths too quickly, failure to clear airway obstructions. Alright, here are the steps for providing mouth to nose ventilation. Use your hand to seal the mouth shut. Seal your mouth around the patient's nose. Deliver ventilations through the nose. Break contact with the nose and open mouth slightly to allow patient to exhale. Keep your hand on the patient's forehead to keep the airway open. Alright, think about it. What diseases can be transmitted through bodily fluids? I'm not going to go into a list of everything that can be transmitted through saliva in the mouth, but you also have to keep in mind that you can have blood in the airway, you can have any type of secretions in the airway. So you can transmit pretty much any infectious disease through mouth-to-mouth contact, provided that there is blood or some other substance in the mouth. All right, why is it important for rescuers to learn mouth-to-mouth and mouth-to-nose techniques? It's important because sometimes that can be, life and death situation. That's just, you have to weigh out your own risks and respond appropriately. All right, special patients. Infants and children, their airways are smaller. They're also easily obstructed. The tongue takes up more space, relatively speaking. Chest muscles are not as developed as adults. The chest cavity and lung volumes are smaller. Alright, so let's talk about ventilation specific to infants. Alright, so you're going to take appropriate BSI precautions. BSI stands for body substance isolation. You can confirm unresponsiveness. You can open the airway. You can also use a barrier device. Assist ventilations with gentle but adequate breaths. You're just looking for that chest rise. This image shows mouth to mouth ventilation of an infant. Terminally ill patients. For guidelines on how to care for hospice or DNR patients, check your jurisdiction or training programs. Just follow your local protocols. All right, stomas. These are airways created by opening outside the neck directly into the trachea. You're going to use a mouth to mask to stoma technique for this. Always take appropriate BSI precautions. Keep the head in the neutral or normal position. All right, ensure the stoma is free of obstructions. Use the same procedures as you would for a mouth to barrier resuscitation, except place the mask or face shield on the neck over the stoma. Do not pinch the patient's nose. So if somebody has a stoma, that's going to be a direct line to their trachea. Their mouth and nose are no longer the primary way to deliver, ventilation in somebody with stoma, obviously. So always use the stoma. All right, this is a surgical stoma on the anterior portion of the neck. If you'll just take a few seconds and take a look at that. All right, crash victims or trauma patients. Airway breathing are always the first priorities. That can be argued that major external hemorrhage could take precedent over airway. That's some of the newer literature that's come out. Take appropriate BSI precautions. Reach victim as quickly as possible. Look, listen, feel for breathing before moving. In suspected spine neck injury, use jaw thrust maneuver. So that's your option where you can use the jaw thrust maneuver or you can use the head tilt chin lift. I always use the jaw thrust maneuver in suspected neck or spine trauma. Right, why is it important to recognize and treat airway issues rapidly in infants and children? Alright, so we talked about it a few minutes ago. Their airways are smaller. Their chest muscles are less developed. They're going to decompensate quicker than an adult. Alright, why is it especially important to take appropriate BSI precautions with the stoma patient? So this is a direct line to the trachea. You just have more potential for having bodily fluids transmitted from a stoma than you do with a mouth to mouth or mouth to nose. What are your first patient care priorities for a motor vehicle collision victim? Like I said, guys, it's always airway and breathing. Keep in mind major uncontrolled external hemorrhage as well. That's a major issue. Air in the stomach and vomiting. Air in the stomach caused by overinflating lungs or breathing too quickly causes gastric distension. The abdomen distends or swells is another word for distension. Creates extra pressure in the stomach. Vomit can obstruct the airway and damage the lungs. Do not push on stomach to release the air. You're just going to cause them to vomit. All right, what can the rescuer do to reduce the chance of gastric distension? Breathe slowly for the patient when you're squeezing your bag valve mask. You don't want to squeeze it violently. Just take a minute and deliver a slow, normal breath at adequate tidal volume. We'll go over that in class when we're doing practical application. And what is the danger of an unconscious patient vomiting? The biggest danger is aspiration, which means getting foreign substances into the trachea and down into the lower airways. This can just cause a bunch of problems. Your book will give over that pretty well. Airway obstructions. Causes of airway obstructions. Most common cause is obstruction by the tongue. This is what you would refer to as anatomical obstruction. Foreign objects, that could be anything that enters the mouth and lodges in the trachea or blocks air from getting to the trachea. This is referred to as mechanical obstruction. Tissue damage is related to trauma. Allergic reactions can cause major swelling in the upper airway. Also infections. Signs of a partial airway obstruction. This is snoring. This is one of the most common things you'll notice on unconscious patients. Most of the time it's because this tongue is obstructing the airway partially. You can alleviate that by repositioning the patient or putting a simple airway adjunct in, such as a nasal airway or oral airway. Gurgling, that's always going to require suction. You can start by putting them in a position such as the left lateral recumbent position we covered in previous chapters. This allows for the airway to drain, but generally you're going to have suction ready to go. Crowing, wheezing, stridor, these are all sounds that you can hear when an airway is partially obstructed. Stridor specifically is going to be just very high-pitched noise, and it's when the glottic opening is partially obstructed. So if you've got somebody that appears to have an airway obstruction, they're still conscious, go ahead and encourage them to keep coughing. Don't interfere with their efforts to clear their own airway. Try to let them clear their own airway if at all possible. Alright, signs of a complete airway obstruction. The responsive patient will be unable to speak, breathe, or cough. The patient will often grasp their neck and open the mouth, which is a universal sign of choking. Will not have typical chest movements or signs of good air exchange. So they're basically not going to be making any noise. They're going to be trying to speak, they're going to be trying to cough, they're going to be trying to breathe, but they've got a complete airway obstruction, so there will be no movement in or out of the airway. It's completely obstructed. Again, they're not going to have any movement as far as what you would expect for somebody who is breathing, because their airway is completely obstructed. There's no way for air to get in or out. Alright, this is a patient displaying the universal sign of choking. Notice her mouth is open. She's got both hands on her neck. This is just automatic. People don't have to be taught to make this sign when they're choking. It's just going to happen. Alright, clearing foreign body airway obstruction. This is going to be for the responsive adult or child. First thing you have to do is determine if there is a complete obstruction or a partial obstruction. Abdominal thrusts are most effective method for clearing the airway. This is what you would refer to as the Heimlich maneuver.
As part of emergency training, medical assistants should be ready to respond to an adult with an obstructed airway. A bolus of food is the most common object adults choke on. When the food is lodged in the upper airway, the person may put his or her hands around the throat, the universal sign of choking. If the person can wheeze, make a high-pitched sound, cough, or speak, do not take any action. Instead, call 911 and encourage the person to continue to cough forcefully to try to dislodge the object. If the person is unable to speak or cough, he or she is in immediate danger and action must be taken. Materials needed to demonstrate proficiency in this procedure are an approved mannequin, gloves, and a ventilation mask with a one-way valve for unconscious victims. Once it has been established that the victim is choking, direct someone to call 911 and say clearly and loudly, "Are you choking?" or "Can you speak?" If the answer is no, as indicated by a head shake, tell the victim you are going to begin emergency treatment. For demonstration purposes, a coworker will simulate a victim in need. Stand behind the victim with your feet slightly apart, placing one foot between the victim's feet and one to the outside. This stance will give you greater stability. If the victim should pass out, you can safely guide him or her to the ground by sliding him or her down your thigh. Place the index finger of one hand at the person's navel or belt buckle. If the victim is a pregnant woman, place your finger above the enlarged uterus. If the person is very pregnant and the uterus is pushing the stomach and other internal organs under the rib cage, you may have to perform compressions. Make a fist with your other hand and place it, thumb side to the victim, above your other hand. Place your marking hand over your curled fist and begin to give quick inward and upward thrusts. There is no set number of thrusts to give to an adult who remains conscious. Continue to give thrusts until the object is removed or the victim becomes unconscious. If the victim becomes unconscious, gently lower him or her to the ground and put on gloves if available. A CPR mannequin will be used for the rest of the demonstration. Before administering rescue breaths, open the airway with the head tilt chin lift and look for a foreign body in the victim's mouth and remove if visible. Blind finger sweeps are no longer recommended and should not be performed. Immediately begin CPR with 30 chest compressions and 2 rescue breaths. Use a ventilator mask if available. Continue with cycles of 30 compressions and 2 rescue breaths until the foreign body is expelled or advanced medical personnel arrive to relieve you. If the object has been successfully removed and the patient did not lose consciousness, the patient may feel he or she no longer needs medical treatment. As a rescuer, you must insist that the victim seek medical attention anyway. The lodged object may have caused swelling in the lining of the esophagus, constricting the throat and impairing breathing.
Alright, stand behind the patient. Place one leg between the patient's legs to obtain a stable stance. Reach around with one hand and locate the patient's navel. You can see he's locating the patient's navel with his index finger. With the other hand, make a fist and place it just above the patient's navel. Now grasp your fist with the first hand and pull in and up with swift, firm thrusts. After we do this, we're going to hope the airway obstruction is cleared and the patient starts breathing spontaneously. Alright, clearing a foreign body airway obstruction in the unresponsive adult or child. Act quickly to determine if you're able to provide ventilations. Take appropriate BSI precautions. With the patient laying face up, tap and shout to assess their level of consciousness or responsiveness. If unresponsive, immediately activate 911. You guys are going to be responding to the location, so you'll be there after 911 is activated, obviously. Alright, begin CPR with chest compressions. After each set of 30 compressions, open the airway and check for a foreign object. Remove it if it's visible. We're not going to do blind sweeps of the mouth trying to dig out something we can't see. Just take a look. If it's there, go ahead and remove it. Attempt 2 rescue breaths. If the breaths do not go in, continue CPR with chest compressions. Alright, this is going to be for the responsive infant. You're going to take appropriate BSI precautions. Pick up the infant and support between the forearms and both arms. Rapidly deliver 5 back blows between the shoulder blades. Turn infant over onto back. Locate compression site and deliver 5 chest thrusts with the tips of the fingers. Continue sequence of back slaps and chest thrusts until the object is expelled or infant loses responsiveness. Alright guys, this is something you guys have all learned in CPR. If you've taken American Heart Association, healthcare provider, which all of you guys have at this point. Next few slides are just going to show some demonstrations. Alright, this is the proper positioning of the infant for back blows. Notice the head is pointed down. This is proper position of the infant for chest thrusts. Again, head is pointed down. Alright, this is for an unresponsive infant. You're going to obviously take appropriate BSI precautions. With infant supine, tap and shout to assess responsiveness. Activate 911. You guys are 911, so you're going to be there after the activation. Begin CPR beginning with chest compressions. After each set of 30 compressions, open the airway and check for a foreign object. Remove it if it's visible. Again, don't start digging in their airway. If you see it, remove it. If you don't see it, just keep doing compressions. You're going to attempt to rescue breaths. If breaths do not go in, continue CPR. Right, this slide is placing the infant supine, which is the position they're in right now, on a firm surface. If unable to detect signs of breathing, start CPR beginning with chest compressions. After 30 compressions, you're going to attempt to rescue breaths. If you're unable to ventilate, you just continue with compressions. Alright, this is some special considerations for obese or pregnant patients. So you're going to determine if there is a complete or partial airway obstruction. While behind the patient, place the thumb side of one fist in the center of the breastbone. That's going to be your sternum, which is the same place you're going to do chest compressions. Grasp fist with the other hand. Give up to 5 chest thrusts in rapid succession. Just means back to back. If airway remains obstructed, repeat the thrust until the airway is cleared or until the patient loses responsiveness. If the patient becomes unresponsive before you are able to clear the airway obstruction, call 911. Again, you guys are going to be arriving after the 911 activation. Immediately begin CPR after they go unresponsive. Alright, so this is just demonstrating how to do chest thrusts on a pregnant individual with an airway obstruction. So position yourself behind them and wrap your arms around their chest. Place the fist of one hand flat against the sternum. Grasp firmly with the other hand and pull in sharply. Alright, finger sweeps. Use the finger to sweep the patient's mouth and attempt to remove a foreign object. You're only going to perform this if you see the object in the patient's mouth. Again, we do not perform blind finger sweeps where we're just digging around in the patient's mouth trying to feel for something that we can't see. It may stimulate the gag reflex and cause vomiting if you do. Only attempt finger sweeps in unresponsive patients, and always be aware of your safety. You never know if somebody's going to bite down on your hand while it's in their mouth, and that's just an unpleasant situation. So just use caution when you're sticking your fingers in people's mouths, okay? Alright, why is it important to call for advanced life support paramedics in the case of a foreign body airway obstruction? Paramedics can do more advanced procedures. They can actually visualize the airway and remove the obstruction manually. I'll demonstrate that in class. What is the purpose of initiating CPR for the airway obstruction patient who has suddenly become unresponsive? You're able to continue to try to dislodge the foreign body, and you can also attempt to deliver breaths when they become unresponsive. Like I said, if they're unresponsive, you're not likely going to be able to hold them up and continue to perform chest or abdominal thrusts anyway. So this just is the progression of how we're going to go about trying to remove the foreign body. Alright, guys, this is going to conclude part B of our chapter 9 lecture. Got one more to go, so I'll see you in part C. Alright, guys, this is another video. Unfortunately, they're not going to come through in the presentation, so I'll just demonstrate it in class.